The best medicine is closing the border with China. That's the demand from thousands of striking Hong Kong healthcare workers want from their government.
I hope the government listens to our demands, quickly closes all the borders and brings this epidemic under control.
It comes as Hong Kong became the second place outside of the Chinese mainland to report a death from the coronavirus. A 39-year-old man who was suffering an underlying illness travelled to Wuhan in January. Hong Kong's chief executive criticised the protesters and defended her decision to leave some parts of the border open.
I certainly would not agree with the allegation that we are sort of not addressing this public health concern adequately.
The alarm has long since spread across China, including to Shanghai, featuring unusually empty streets. But among those out and about,
Hello.
Taking precautions is a must.
I make them wear masks when they go out. When they come home, they have to wash their hands. I believe in our country. We'll overcome this.
The number of confirmed infections rose by several thousand again, leaving many wondering when the worst will be over.
For more, let's bring in Charlotte Chelsom-Pillow, our correspondent in Hong Kong. Charlotte, what has been the impact of this strike regarding the medical services in the city?
Well, this is now the second day of a 5-day strike by those medical workers here in Hong Kong, Sarah, and authorities are already saying that there has been a serious impact on the healthcare community here. The medical authority has already warned that emergency services have been affected, citing in particular cancer care and neonatal intensive care as well. So there is some concern about these thousands of people who've walked off the job already and what could happen in the days ahead. Those who are taking part in this strike, though, have pointed out that any disruption to medical services so far will be nothing compared to the disruption of a major outbreak of the new coronavirus here in Hong Kong. They are warning that as it stands, not enough preventative measures have been taken, including a full closure of the borders, and they say that they are not adequately prepared to be able to deal with a major outbreak here.
But nevertheless, I mean, how much support is there for these striking personnel? Because, you know, just on the face of it, it appears counterproductive to strike at a time when the coronavirus is indeed spreading.
Well, that certainly has been the argument from some in the medical profession, warning, as you say, now is not the time to walk off the job. The Chief Executive Carrie Lam's also been urging medical staff to go back to work too. She's criticised this strike. Now, what has to be pointed out is not all medical staff are taking part in this. This is something that's been organised by a new union that was set up recently during the the anti-government protests. People that we've spoken to, though, whether or not they actually support this strike action, do largely seem to be behind the motivation for this strike. People we spoke to said that they do want all the borders with mainland China to be closed. That, of course, has those fears only being increased today by the news that a 39-year-old man who had visited Wuhan in mainland China, the epicenter of the outbreak, has lost his life today. There have been 2 more confirmed cases, and the fear that 4 of those 17 cases now confirmed may have been transmitted here in Hong Kong. There is no, those 4 aren't known to have travelled to mainland China. That is something that is only increasing fear here, particularly in light of the SARS epidemic, as has been mentioned, in which nearly 300 people lost their lives in this very densely populated city. So a lot of people here say they do support the full closure of the borders here with mainland China.
Charlotte Chelsom-Pillow in Hong Kong. Thank you, Charlotte.